Are you a cash-based physical therapist looking for clinical pearls to improve your clinical outcomes in your cash PT setting? I'm here to show you one inside this video today. My name is Dr. Chris Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes and thrive in business. What's one clinical pearl that you can be adding in that you're not doing inside your PT practice? That's the 80-20 rule. Let me explain. In insurance-based care, you are used to, I have to get through this patient as quickly as possible in an organized fashion because I have to be able to check up all of these boxes for the insurance company or for the primary care physician or for the surgeon. You are filling out all of these things so that you can get reimbursement for payment. Now in a cash-based setting, there's no longer reimbursement for payment. It's all about the patient. The patient is now telling you what they want and they need. You're going through that whole process. You're managing their back pain, going through the entire gamut of questions. You go through the movement screen, you go through their treatment, you give them correctives, and you send them on your way, and you rinse and repeat every single time. Let me add something into your current regimen that you're missing that you would have never gained insight into if you were just doing insurance. Now that you have more time on your hands, this 80-20 rule applies to not just your initial evaluation, but all follow-ups. And this simply describes the ratio of talking back and forth between you and the patient. Why is that important? Well, most PTs want to provide all the information. You're used to word vomiting because you only had 15 to 20 minutes in the past with insurance. And so you only had that time to educate the patient with everything. So you word vomited on top of them so they can take home all the information. You gave them a packet, you gave them 57 exercises in case they didn't show up. That was your insurance policy. Now in a cash-based setting, that cash-pay patient's willing to pay, they want to be listened to. Well, because you were not listened to in the past, you didn't have the time, you brought that same word vomiting over to cash. Now, this patient is saying, hey, I want somebody to listen to me because I was used to an insurance-based setting and now I want to be heard and listened to. And you're like, that's fine, I'm a cash pay PT. The problem is you still have the habits of the insurance side. So they ask one question. Why does my back pain hurt, right? Then you're gonna pull out your notes, your encyclopedia. Well, let me show you what the lumbar spine does. And this is the foramina, this is the blah, blah, blah. And the patient's like, how does that affect me? You're speaking medical jargon to a patient who doesn't understand that. So here's the problem. You're talking too much. You're talking too much about yourself, about your clinicals, your rotations, who you are, your credentials, why you're the best. And this patient is still not being heard. So the 80-20 rule is a very, very simple equation. 80% of the time is having the patient, allowing the patient to talk about themselves, getting them to talk about anything they want, their lives, kids, their families, their hobbies. They're paying you to deliver on a service. So to make that experience that much better, you're gonna allow them to talk. And you ask better questions to get them to talk. Now here's the problem. You're not used to that because you didn't want patients to talk inside an insurance-based setting. So what you did was you asked yes or no questions and they weren't very open-ended so you can get the responses you want so you can file the paperwork as quickly as possible. Now you come over to a cash setting and you ask them, how are the kids? They say, good, great. And you go on and you start talking about yourself and the low back and all these features that don't really matter to these people. But asking better open-ended questions allows you to gain better insight into who they are, what their hobbies are, what they're interested in, and allowing them to have that decompression time. Now, 80% of the time, they should be talking about themselves. 80% of the time. Or their family, whatever it is, their lives. That's a great part. It allows them the time to express frustrations, concerns, and helps you put the case better together. Maybe they're stressed and maybe their back pain is coming over from picking up their kids more often. You didn't know that because they said it during the conversation they were having talking about themselves. It allows you to explore, to have a better subjective. And that's what you fail to realize is that's your time to gain your subjective even when they're prone, supine, sideline, all the other things. But they should be 80% of the time talking about themselves or their own family, whatever it is. The other 20% of the time, it should be you talking, but asking more questions about them. So when in reality, this hour or 45 or an hour and a half, whatever your session is all about the patient. And that's the customer experience. They're coming here, to get to know you, absolutely. And they ask, what are your hobbies? Fantastic, I play pickleball, whatever it is that you do. Great, what hobbies do you do? And flip that back to them. This is their time. Give them the time that they're paying for and that they need. If you're over here talking about yourself and they're like, well, I want this to solve my pain, and you're talking about yourself, your hobby, your marriage, your kids, everything else, that's fantastic for a few minutes, but flip it back and give them that time, give them that platform. Patients will love this, and they don't even know that you're doing this. And the reason why you do this is because it's customer service. It allows them to feel like they are being served inside your organization, and that's ultimately what you're here to do. You serve others. That's the ultimate goal, to be able to do things that you need. Now, you need more information about them to make the decisions possible. So if they say, well, when can I go back to tennis? And you learned through asking them 80% of the time is about themselves. Now you're realizing, wow, you're very busy. I might have to cut you down your corrective exercises, or you're going through a lot right now. You're not going to be compliant. So let me shorten down some exercises, or you really are not doing anything physically active. Now let me bump you up. I have a little bit more, but you would never know that until you continue to peck and peck and peck and ask about their lives, because it gives you more information so you can help them from a holistic standpoint. Because you're traditionally used to knee pain, back pain, shoulder pain, you obsess about those key points. You don't find out about their habits. You don't find out about their fitness or their work life or anything else. So you can't put the full picture together. You're just putting isolated parts. And that worked well in an insurance-based model, but it won't in a cash-based setting. So if you're looking to improve clinical outcomes without more CEUs or clinical skills, allow that patient to have a better experience by applying the 80-20 rule. 80% talking about them, 20% asking about them. And that allows you to get more information, get them to buy into everything that you're doing, establish a better relationship, and have a more compliant, happy customer. So if you're still struggling with your cash PT, or you haven't been able to make it yet, you're still doing your side hustles, this is one small thing that you can be adding in as of yesterday or today. Good luck. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.